Greetings, this is Brandon E., your Pharm.D, and welcome to my YouTube channel. You know, all of us have experienced heartburn at some point in our lives, so let's discuss a little bit about what it is first. We all have acid in our stomach, and when you hear the word acid, you may think it's a bad thing, but acid in our stomach is actually very helpful. It helps us to break down food for digestion. It helps liberate certain vitamins from foods like vitamin B12 so we can absorb them, and it helps to kill bacteria to prevent us from getting an infection in case we ingest some. So when we eat food, food travels from our mouth to our esophagus to our stomach. And between our esophagus and our stomach, there's a valve called the lower esophageal sphincter. And this valve opens and closes to allow food and drink into the stomach. If this valve is functioning improperly, acid or the contents in our stomach can reflux or flow back into our esophagus. This process is known as acid reflux. This acid reflux can create a burning, painful sensation in our chest, and this is termed heartburn. So what are some causes or triggers of heartburn? Number one, certain medications can cause heartburn. There are a lot of prescriptions like antibiotics or certain medicines for osteoporosis called bisphosphonates that can cause heartburn. If you're unsure if you're on a medicine that can cause heartburn, generally check the prescription label, or you can check with your doctor or pharmacist. Other causes or triggers can be pregnancy, smoking, stress and anxiety, abdominal pressure, obesity, foods like carbonated beverages, chocolate, caffeine, alcohol, and then certain lifestyle choices. And we'll discuss a lot of these later in the video. So when should you see a doctor if you have heartburn? Number one, if you have chest pain, but this type of chest pain is more of a cardiac chest pain as opposed to a heartburn type chest pain. So if you have pressure in your chest, tightness, squeezing, or pain that starts in your chest and then spreads to other areas like your shoulders, back, neck, or jaw, this could mean that you're having a heart attack, so you want to seek immediate medical attention. Also, if you need more than a 14-day course of a proton pump inhibitor in a 4-month period. Proton pump inhibitors are medicines like over-the-counter Prilosec, over-the-counter Prevacid, and we'll discuss these more later. Or if you have difficulty swallowing, persistent nausea and vomiting, or heartburn with frequent wheezing. So what are some lifestyle changes that we can make to relieve our heartburn symptoms? Number one, you want to avoid eating and then going directly to bed. You want to eat at least 2 to 3 hours before you go to bed. If you eat and then go to bed, this puts a lot of pressure on the esophagus and again can allow the contents of the stomach to flow into the esophagus, causing your heartburn symptoms. Also, you want to avoid alcohol and stop smoking. Both of these can relax the lower esophageal sphincter, again, which we talked about as the valve that allows food into the stomach. Also, you want to avoid wearing tight-fitting clothing. Again, we talked about abdominal pressure can cause heartburn. So if you wear a lot of tight belts and tight clothing, especially in your abdominal area, this can cause heartburn. Next, you want to avoid certain foods that may worsen your heartburn, like certain spicy foods, acidic foods, carbonated beverages, and any other foods you may notice. Another option is to elevate the head of your bed or use a wedge pillow. These actions, along with gravity, will help keep the stomach contents inside the stomach. So now let's talk about some over-the-counter medicines we can take for heartburn. The first class we're going to discuss are Antacids, and these are medicines available over-the-counter like Tums, Rolaids, Alka-Seltzer. These medicines work by neutralizing stomach acid in the stomach and in the esophagus. The advantage to these type of medicines is that they work very quickly. They generally work in a couple of minutes. The downside is they don't last that long. They may only last a couple of hours, maybe 1 to 3 hours. So if you're having heartburn symptoms throughout the day, you may have to take these types a couple times to maintain the relief. And depending on the type you choose, they can have different side effects. If you choose an antacid with aluminum like Gelusil or calcium like Tums or Rolaids, they could cause constipation. If you choose an antacid with magnesium like Mylanta or Malox, they could cause diarrhea. Or if you have kidney problems, you want to check with your doctor before using an antacid with magnesium. Also, if you choose an effervescent type like Alka-Seltzer, They have salt in them and they can raise your blood pressure. So if you're on blood pressure medicines or have hypertension, you probably want to avoid this type. This type also has aspirin in it. So if you're at risk of bleeding, this may not be a good option as well. Also, antacids can interact with certain prescription medicines. So if you're on any other prescriptions, you want to check with your doctor, pharmacist, or read the label, as you may need to separate them by a couple of hours. So now we're going to talk about the next class of medicines. And the next class are called H2 blockers. And these medicines are medicines like Pepcid or famotidine, Tagamet, cimetidine, or Zantac or ranitidine. And these medicines block histamine in the stomach, which causes less acid to be produced. But they're not the same as medicines like Claritin, Allegra, which are antihistamines for allergies, again, because these medicines work in the stomach. The advantage to this type of medicines is that they can prevent and treat heartburn symptoms. So if you know you're going to eat something spicy that's going to cause heartburn symptoms, you can take these medicines like 15 to 30 minutes before doing so, and they can prevent you from having heartburn symptoms. These medicines also last about 12 hours. The downside to this class of medicines is that as you take them, they could lose effectiveness. So if you take them on day 1, 2, and 3, and then take them again on day 7, 8, and 9, they may not be as effective on day 7, 8, and 9 as they were on day 1, 2, and 3. So now the final type of medicine we're going to talk about are proton pump inhibitors. And these are medicines like Prilosec or omeprazole, Prevacid or lansoprazole, and Nexium or esomeprazole. And this class of medicine should be used if you have more frequent heartburn, like symptoms 2 or more times a week. These medicines work by blocking the proton pump or acid pump that releases acid into the stomach. The downside is that they take 1 to 4 days to start working, and they're fairly expensive over the counter. But again, they are the best at treating acid reflux or heartburn over the counter. And there have been some reports of these medicines causing infections and decreased vitamin absorption, which is true, but if you're taking a short course over the counter, this shouldn't be an issue. So now let's put everything together. Let's say you're having heartburn symptoms. What should you do? First, you want to do the lifestyle modifications to kind of relieve your symptoms. Raise the head of your bed, use a wedge pillow, stop smoking, avoid alcohol, avoid wearing tight-fitting clothing, avoid foods that you notice cause your heartburn. And then from there, if that's not enough, you want to go to the over-the-counter medicines. If you're having symptoms here and there, you can take an antacid like Tums or Rolaids. Or if you want to prevent symptoms, you can use an H2 blocker, again, like Zantac, ranitidine, Pepcid, or famotidine. And these medicines last about 12 hours, and they can prevent and treat heartburn symptoms. But again, the downside to these is that as you keep taking them, they may not work as well. Or you could do a combination. There's a combination product available over the counter, Pepcid Complete, and it's a combination of antacids and an H2 blocker. So the antacids help the person get relief very quickly, and then the H2 blocker part can last longer. If you're having frequent symptoms 2 or more times a week and the first 2 classes aren't working, then you can go to a proton pump inhibitor. But again, these take about 1 to 4 days to start working. There's a product over the counter called Zegerid that's a combination of an antacid and a proton pump inhibitor. So you get that quick relief from the antacid, but then you get the better, more effective relief from the proton pump inhibitor. So while the proton pump inhibitor is taking time to work, you have the benefit of that antacid. So this was the video on heartburn. Let me know in the comments if you have any further questions or if something was unclear. And I'll catch you on the next video. Be sure to subscribe if you haven't done so already. This is Brandon E., your Pharm.D. Remember to drink water. I hope this video helps.